And Mr. Pawlenty joins us now at the Minnesota State Fair. It's good to see you.
Good to see you, John.
Big speech from the president Wednesday night. You have been harshly critical of him and his approach throughout the healthcare debate. Give me one thing that the president could say where you would say, okay, he's serious about reaching out. Let's turn off the rhetoric machine and try to do business.
Well, one thing he could do, Harvard University recently came out with a study that said that 30% of all the health care in the United States of America is medically unnecessary, and one of the driving reasons why that's being the case is a fear of medical malpractice lawsuits. Everyone in this debate realizes we've got an overbaking of the cost because of medical malpractice concerns, so he could take on one of his constituencies, which is the trial lawyers, and say, you know what, we need to come together on this issue. Republicans would embrace that as one example.
If he were to do something like that, would you embrace a backup public option if they went to the trigger approach, that we create a public option, but it only kicks in if 3 years or 5 years, they'd set a deadline, if the insurance market isn't more competitive, if there isn't more access, there isn't more affordability?
There's lots of things we could agree to on a bipartisan basis, John. The public option isn't one of them. The trigger option simply kicks the can down the road. All it does is delay the inevitable, and for a lot of reasons it's a bad idea. I think if the Democrats embrace the public option, even in the form of the trigger, they're going to shoot themselves in the foot.
What about a thing you see quite frequently out here, including in your state and throughout farm country, is a co-op? If they came up with a co-op approach instead of a public option, could you help them there and support them?
Well, Minnesota is actually a state that has elements of a co-op approach. And many, many years ago, people decided in this state we're going to have only nonprofit health care providers. And while it has helped a little bit at the margins, it hasn't solved the problem. It's helped a little bit at the margins only in some cases. So to say that that is the solution, I think defies what we know about the experience with co-ops already. It hasn't substantially altered the trajectory of health care costs.
So do you believe the president will get a bill this year?
I don't know. I hope that we could come together on a bipartisan basis. Again, there's lots of things we could agree on. Medical malpractice reform, embracing electronic medical records, embracing electronic prescriptions, allowing people to pool risk across state lines, allowing people to be able to buy insurance across state lines. Let's pay for performance, not for volumes of procedures, and much more. And let's set aside the things we can agree on. And the Republicans are not going to agree on the public option, nor should they. It's a bad idea.